Yes.
We can.
It's time for the Russ Belville Show's Cannabis Q&A with Dr. Mitch Earlywine. Dr. Earlywine is a professor of psychology at the State University of New York at Albany and a leading author and researcher on cannabinoids and health, who pins the Ask Dr. Mitch column for High Times Magazine. Get your questions ready in our live chat or call in to 971-533-7111 now.
Welcome back, everybody. Half past on a Monday, and that means it's time for our weekly visit with the doctor. Dr. Mitch Earlywine's in. How are you doing, Dr. Mitch?
Having a great day.
I'm having a great summer day myself. We just recovered from Seattle Hemp Fest, and I was smart enough this year to use loads of sunscreen, so I don't have my typical hat sunburn I usually have.
They say you can't teach an old dog new tricks.
Who would have thought? I actually learned something. Hey, folks, if you want to get your questions in for Dr. Mitch Earlywine, get into our chat room. It's at ustream.tv. You can just log in, create yourself an account, and get your questions in. If you add Q: at the beginning of your question, it makes it a little easier for us to pick out of the chat. Or you can just call in the old-fashioned way, 971-533-7111. And we always let Dr. Mitch have the first word here to give us the updates on what's new in cannabis science.
I didn't know if you got the chance to rant about this lead poisoning versus cannabis issue, and I'm happy to chime in if you don't feel like you've already beaten it to death. And there's also a new study in drug and alcohol dependence I'd love to discuss.
Let's talk about the drug and alcohol dependence one. I'll bring the lead one up around the end of the segment.
Well, so the clincher here is essentially we've seen lots and lots of evidence suggesting that early cannabis involvement links to school dropout. Mm-hmm. So the idea is somehow the cannabis makes you not want to go to school, the way it drives you crazily to do heroin and all this other crazy stuff. And I'd always thought that this was really a third variable explanation. We have a new paper in Drug and Alcohol Dependence suggesting that that really is the case. So it's not that cannabis leads people to not want to hang out at school. It's that the risk of dropping out and the risk of cannabis use are two correlated personality variables that tend to co-vary, and it's not at all that cannabis is causal of school dropout. It's that a third thing is causing each of early cannabis use and school dropout.
For an example here, we could talk about a kid who's got a lousy home life, parents are getting divorced, he's suffering abuse and neglect, maybe he's got bad nutrition, all these things that lead him to want to drop out. Oh, and he happens to smoke pot, so that's what they want to pin it on, and it's just not so.
In fact, that correlation is completely spurious, and all those other things you mentioned are much more likely contributors to each.
All right. We've got a question from our chat room. Randy Brush would like to know, where is the best place for people to get current, trustworthy info on cannabis?
As lame as it sounds, Google Scholar is available to everyone. And if you go ahead and just put cannabis in the title, you'll be stunned at how much you come up with. And marijuana also seems to work well, although you usually get the biased anti-cannabis stuff when you use that as a title.
All right.
Like googlescholar.com.
Well, there's a little organization Dr. Mitch is on the board of called Normal. There's a great place to find some stuff, too. Normal.org.
I find it much more accessible, but it's hard for poor Paul to keep everything as up to date. So we do the best we can.
Yeah, there's some great information there. Between the cannabis, he's got the guide to cannabis and how it works on, the latest scientific rational guide on the conditions it will work for. He's got a guide on cannabis in the brain. He's got a guide on cannabis and driving. You should read all three of those things and then, supplement your knowledge from some other sources. I would definitely recommend that. All right, let's get to this one that you mentioned. I got this forwarded to me by a few people, and of course it just continues the reaction from the rehabitionists on the Sanjay Gupta weed special. And of course, the Riddler to my Batman is Dr. Chris Thurstone out there in Denver with his whole rehab entrepreneur lifestyle out there. And he's got a post up that says, "Why worry about lead but not weed?" And this is taken off of a post he interviewed someone named Paula Riggs, and they make this point about lead poisoning in the United States and how there used to be lead in our in materials that kids would eat or drink, and that caused terrible problems, and we work to reduce lead poisoning, reduce lead in our products so that they would help the kids. And they're trying to tie this and say marijuana is as bad as lead poisoning because, oh no, both of them cause drops in IQ. And boy, the only thing I had in the rant on this, Dr. Mitch, is I don't recall, doesn't lead kill people as well? So how much more can we poke a hole into this?
I mean, this is so misinformed, it's hard to know where to start, but I want to emphasize that there was one study by Peter Fried showing slight IQ drops in folks who were heavily involved with cannabis early in life who used every single day. In that same data set, what never gets mentioned is the folks who used once a week actually had their IQs go up. Of course, that's complete taboo. We can't bring up that topic. And then at the time lead was removed from gasoline, we had 24 different data sets showing that lead led to decreases in IQ, as well as all kinds of blood diseases and all kinds of other problems, right? Not a single study suggesting that IQ might drop, but it didn't seem to be related to dose, because if you had a low dose, it actually went up. So that alone makes me think that these guys are really grasping at straws, and anything to keep those beds full in your own treatment program.
Yeah, and of course, not to minimize the effect of lead. I mean, we're not saying lead's good. Lead was awful. We made sure we got that out of the paint and out of the gasoline, and we did see statistical changes in the IQ of children following that public health move. So that was legitimate, but trying to tie that to marijuana just seems ridiculous to me.
It's quite a loose association. It sounds more psychotic than any psychosis caused by cannabis.
Yeah, really. Speaking of harm reduction, I wonder if you saw that while we were out there at Seattle Hemp Fest, we had the cops passing out bags of Doritos that had the rules for I-502 on them. And it made me wonder that, gosh, the cops are passing out something that's more harmful than weed.
I hate to say it, but long-term consumption of cannabis is one thing. Long-term consumption of trans fats is really dangerous.
All right, we have a question from our chat room. Dreamweaver wants to know, what is your latest book on the subject of cannabis?
As it turns out, I've been asked to revamp Understanding Marijuana, but right now Les Iverson has The Science of Marijuana out that I think is probably the most up-to-date thing that's handy right now. And I'm chipping away at this, and I'm hoping to have it finished up by the end of 2014. Oh,
excellent news. All right, we've got a question from Trickster Phillips, who wants to know, what, if any, cannabinoids can aid in brain plasticity to form new pathways around areas of the brain damaged by lesions and plasticity in general. I guess this kind of relates to, I've heard about the promise of cannabinoids in treatment of concussion. Is that what we're getting at here?
I think that's the case, and right now at least THC and cannabidiol are showing a lot of positive effects in the animal models, but you have to administer them almost immediately after injury, which says to me you better carry your vaporizer around whenever you're anywhere near someplace you could get a head injury. But that's such a strange idea. I don't really know how to establish it, and of course we just don't have the data on human yet. But a whole lot of things that are supportive of brain plasticity in rats have generalized pretty well.
Here's a good question we've got from Howdy Y'all, who asks, is secondhand cannabis smoke, a.k.a. stingers, effective? And that, I think maybe that's just a regional variation. We always called it shotgunning, when you took a hit and then you blew it into someone else's mouth. Is that really effective for someone, or is the person getting the shotgun hit really just a placebo effect there?
It turns out that it really depends on how deep that initial inhale is, and of course there are no funding agencies ready to investigate this. So if the first hit is really huge and not necessarily held for a very long time, there could be plenty of THC left. If it's relatively small and held a long time, the THC will all be absorbed in the first person's lungs.
Okay, so don't get any shotgun hits from Michael Phelps. He will have already metabolized it all.
You got it.
Question from John Thomas wants to know, it appears Rick Simpson oil may be effective against skin cancer. Are some of the concentrates in dispensaries equivalent to that, or is there a different manufacturer for this Simpson oil?
I don't mean to badmouth Rick Simpson. His technique looks very much like the techniques I've seen with some of the other creations of oils. but I don't think there's any novelty to his. I think any of these should generalize to any other one. But again, we don't have data other than case studies on these miraculous cures. And some of these disorders, including cancer, tend to ebb and flow. Sometimes, certainly get worse and sometimes also get better with other treatments. We've got individuals who certainly report that they've done really, really well, and I couldn't be more delighted, but we really do need to randomly assign folks and have larger samples before I can say that any of these oils can really cure anything.
Yeah, let's get a few thousand cancer patients together and try this out and really study this stuff. What's the government afraid of in this case?
Beats me. I think the giant industry that's cancer.
Yeah, probably that. All right, Mark Rips has a good question here, real important considering how popular dabs are getting. He wants to know, are the chemicals in wax and what they're using for creating wax, and that would be dabs or oils, whatever, are these chemicals and the wax itself more toxic than traditional smoke?
So my student, Mallory Laughlin, who some folks met at that Philly conference, has gathered just some modest self-report data on this that suggests that at least in the short run, that's probably not a big issue, but that there's a tremendous amount of variation across places. So we had a wonderful talk at the last normal conference about how this is done correctly and the intense and time-consuming procedures involved in making sure the various solvents had been essentially boiled off. But quality control is kind of limited, so it's important that we had a tax and regulated market where we could really have a closer eye on these things.
Okay, and another question, I like this one actually. When was lead removed from cannabis? I guess I get that from our. There's never been any lead in cannabis.
If I said that, I meant gasoline.
And but we do know that hemp can be used for phytoremediation. When you need to take toxic heavy metals out of the earth, you need to get radiation out of, say, Chernobyl. You can plant hemp and help to leach those toxins from the soil. So there's our little tie-in for the joke. I think that'll work.
I appreciate it.
Dr. Mitch, I had one question here to wrap up the segment, but before we go, I want to let people know that if you didn't get your question in, you can always email Dr. Mitch directly at 420research@gmail.com, or just go to the 420radio.org contact page, and we've got a drop-down menu that'll get your content right there to Dr. Mitch as well. But I wanted to ask this question. The folks, these rehabitionists, their latest thing that they're going on is trying to scare us about big tobacco and how these marijuana companies, once it becomes legal, would have to market to younger tokers. Now, we know that people tend to start smoking marijuana between age 16 and 17, and the bulk of people that use it are between the ages of 15 and 25. So how much truth could there be to the notion that big marijuana companies would have to market to kids when it seems to me more older people are the ripe market ready for, picking?
I think the clincher here is keeping our teens informed. The idea that a tax and regulated cannabis market necessarily has to mean one where there's commercials for cannabis on every TV show is certainly, doesn't follow. And as more and more data suggests that, hey, this really isn't adaptive before the brain is fully developed, we can spread the word on that, and I actually trust the intelligence of other people to make sure that goes okay.
And one last quick one from Howdy Y'all wants to know, is the University of Mississippi location still the only place where cannabis for the government study is grown?
Sad but true, although I'm looking kind of enviously at my pals at universities in Washington and Colorado whose institutional review boards are starting to get a little more flexible about the idea of maybe letting cannabis be administered at those universities.
Oh, wow. University of Colorado, University of Washington system could possibly actually let them use cannabis for study, even though it's only state legal?
Well, as long as they aren't using federal funding, that's at least something that the attorneys at each place are considering.
Oh, wow. That's amazing news, and I hope they get to go on that. Dr. Mitch, thanks for joining us here every Monday on the Russ Belville Show. And, folks, get your questions in for next week. We'll do it all over again. Thanks, Dr. Mitch, and enjoy your day. All right, folks, when we come back, we have got my speech from the Seattle Hemp Fest at the McWilliams stage, plus some videos from Dab Central, including Ganja John and our Atlanta friends, Stony and Snap. Stay tuned.
It's simply business. It's simply business. It's simply business, you know why they won't let us grow. It's simply business.
We'll be right back after these messages from our 420 friendly sponsors. Support these advertisers because their ad money goes straight to the Russ Belville Show. You're tuned into the Russ Belville Show, the voice of the marijuana nation.
It's simply business. It's simply business. It's simply business, you know why they won't let us grow. It's simply business. It's simply business, you know why they won't let us grow. It's simply business.